How to inject your Wegovy pen. So Wegovy comes in two different types of pens. There's a single-use pen that can be used once and then discarded, and a multi-use pen that's used more than once for multiple injections. Both pens can deliver either 0.25, 0.5, 1, 1.7, or 2.4 milligrams. Depending on where you live, you may only have access to one of the pen types. The single-use pen comes with one preset dose and a needle cover that hides the built-in needle. When the needle cover is pressed against your skin, the pen will deliver an automatic dose. This is different than the multi-use pens, which deliver 4 weekly doses of either 0.25, 0.5, 1, 1.7, or 2.4 milligrams. These pens come with 4 disposable needles that are referred to as Flex Touch pens. Where I'm located, we have access to the Flex Touch pen, so I'll use that to demonstrate how to do an injection. As you can see, this is a Flex Touch pen that delivers the 2.4 milligram dose per week. So first of all, check that the fluid in your pen is clear and colorless. You're always going to use a new needle for each injection with this type of pen, which is why this box comes with 4 disposable needles. When you're ready to inject, what we're going to do is open your box of needles, take one out, and peel the paper top off of it. This is what keeps it sterile. You're going to screw the needle on the end of your pen until it's nice and tight. Now, it's important to remember that these needles have 2 plastic caps on them. Remove the outer cap, set it aside for later, then you have to remove the second inner cap and you can dispose of that. If this is your first time using a brand new pen, you're going to prime it or check the flow before doing your first injection. So you're going to turn the dial until the line lines up with the dose indicator on the side. You're going to see a line with 2 small dots. Then what you're going to do is press and hold the button on the end until this dose counter returns to 0. You may not be able to tell, but there's a drop of liquid at the end of the needle, and that indicates that your pen is ready for use. So, now that the dose selector has turned to 0, what we're going to do to inject our first dose with this pen is turn the dial on the end until it stops, and the window will show your prescribed dose. So as you can see, this pen goes to 2.4 milligrams. You can inject in your abdomen, upper arms, or upper legs, but I'll demonstrate using this prop instead of your skin today. Just an FYI, you don't have to clean your skin with an alcohol swab before inserting the needle, and it's also normal to see some minor bleeding or bruising at the site afterwards. So what you're going to do is you're going to insert the needle into your skin, and you want to make sure that you can see that dose counter window. We're going to press and hold the dose button at the end until the dose counter returns to 0. And you might hear or feel a click when it reaches 0. So let's do that now. It's gone to 0, but we're going to keep pressing that button with the needle in your skin and count to 6. 1, 2, 3, 4, 5, 6. Then we can let go of the button and remove the needle from your skin. You don't want to pull the needle out too quickly, as the medication may still be injecting and you won't get your full dose. Next, you're just going to slide your needle tip into the large outer cap without touching that needle and press firmly. Unscrew the cap completely and dispose this in a sharps container. Lastly, we're going to put the cap back on the pen to protect it from light. And that's it.